12 essential warning signs of heart disease in men that must not be overlooked. Heart disease is a term used to describe a range of conditions that affect the heart, such as coronary artery disease, heart attacks, and heart failure. It is a leading cause of death globally and affects both men and women. The good news is that heart disease is often preventable by making lifestyle changes, such as eating a healthy diet, exercising regularly, and quitting smoking. Early detection and treatment of heart disease can greatly improve the prognosis and quality of life. This video will provide information on the warning signs of heart disease in men, its causes, and treatments, as well as a natural remedy in the form of a ginger tea recipe. It is important to seek medical attention if you experience any symptoms or have risk factors for heart disease. Chest pain or discomfort. Chest pain or discomfort is one of the most common warning signs of heart disease in men. This can feel like pressure, fullness, tightness, or burning in the chest, and can occur during physical activity or at rest. Chest pain or discomfort can be caused by a variety of heart problems, including angina, reduced blood flow to the heart attack, blockage of a coronary artery, or a tear in the aorta, the major blood vessel that carries blood from the heart to the rest of the body. Shortness of breath. Shortness of breath is another common warning sign of heart disease in men. This can occur suddenly or gradually, and can be accompanied by chest pain or discomfort. Shortness of breath can be caused by heart problems such as heart failure, when the heart is unable to pump enough blood to meet the body's needs, or lung problems such as pulmonary edema, fluid buildup in the lungs. Pain or discomfort in the arms, back, neck, jaw, or upper stomach. Pain or discomfort in these areas can be a sign of heart disease, especially if it occurs along with chest pain or discomfort. The pain may be described as aching, burning, or sharp. Pain or discomfort in these areas can be caused by heart problems such as angina, heart attack, or aortic dissection, a tear in the aorta. Fatigue or weakness. Fatigue or weakness is a common warning sign of heart disease in men, and can be a result of the heart not being able to pump enough blood to meet the body's needs. Fatigue or weakness can be caused by heart problems such as heart failure, when the heart is unable to pump enough blood to meet the body's needs. Lightheadedness or dizziness. Lightheadedness or dizziness can be a sign of heart disease in men, especially if it occurs suddenly or during physical activity. This can be a result of low blood flow to the brain. Lightheadedness or dizziness can be caused by heart problems such as arrhythmia, irregular heartbeat, low blood pressure, or reduced blood flow to the brain. Rapid or irregular heartbeat. A rapid or irregular heartbeat, known as arrhythmia, can be a warning sign of heart disease in men. This can cause the heart to beat too fast, too slow, or erratically. Rapid or irregular heartbeat can be caused by heart problems such as arrhythmia, heart attack, heart failure, or problems with the heart's electrical system. Swelling in legs, ankles, and feet. Swelling in these areas can be a sign of heart disease, especially if it occurs along with shortness of breath or chest pain. This can be a result of fluid buildup caused by heart failure. Swelling in these areas can be caused by heart problems such as heart failure, when the heart is unable to pump enough blood to circulate properly, leading to fluid buildup in the legs and feet. Numbness or coldness in legs and feet. Numbness or coldness in the legs and feet can be a warning sign of heart disease in men, especially if it occurs along with swelling. This can be a result of reduced blood flow to these areas. Numbness or coldness in the legs and feet can be caused by reduced blood flow to these areas due to heart problems such as peripheral artery disease, narrowing of the arteries in the legs and feet. Difficulty sleeping or snoring loudly. Difficulty sleeping or loud snoring can be a sign of heart disease in men, especially if it is accompanied by shortness of breath or pauses in breathing during sleep. Difficulty sleeping or loud snoring can be caused by heart problems such as sleep apnea, pauses in breathing during sleep, which can lead to reduced oxygen levels and increased strain on the heart. Persistent coughing or wheezing. Persistent coughing or wheezing can be a warning sign of heart disease in men, especially if it occurs along with shortness of breath or chest pain. This can be a result of fluid buildup in the lungs. Persistent coughing or wheezing can be caused by heart problems such as heart failure, which can lead to fluid buildup in the lungs. Increased sweating. Increased sweating, especially at night or during physical activity, can be a warning sign of heart disease in men. This can be a result of the body's attempt to regulate its temperature in response to reduced blood flow. Increased sweating can be caused by heart problems such as heart attack, when the body's stress response triggers increased sweating. Unusual or prolonged fatigue during physical activity. Unusual or prolonged fatigue during physical activity can be a warning sign of heart disease in men. This can be a result of the heart not being able to pump enough blood to meet the body's increased needs during physical activity. Unusual or prolonged fatigue during physical activity can be caused by heart problems such as heart disease, when the heart is unable to pump enough blood to meet the body's increased needs during physical activity. This can lead to fatigue and reduced physical ability. The treatment for heart disease will vary depending on the underlying cause and the severity of the condition. Some common treatments include lifestyle changes. Making changes to your diet, exercise routine, and quitting smoking can help improve heart health and reduce the risk of heart disease. Medications. There are a variety of medications that can be used to treat heart disease, including cholesterol-lowering drugs, blood thinners, and medications to control blood pressure and heart rate. Angioplasty and stenting. Angioplasty is a procedure where a small balloon is used to open up a blocked artery, and a stent is placed to keep the artery open. Coronary artery bypass surgery. This is a surgical procedure where a blood vessel from another part of the body is used to bypass a blocked coronary artery and restore blood flow to the heart. Pacemaker or defibrillator implantation. A pacemaker is a device that helps regulate the heart's rhythm, and a defibrillator is a device that can shock the heart back into a normal rhythm if needed. Heart valve repair or replacement. In some cases, heart valve problems can be fixed with minimally invasive procedures, or with surgery to repair or replace a damaged valve. It is important to work with a healthcare provider to determine the best course of treatment for your individual needs. One natural remedy for heart disease is to include ginger in your diet. Ginger has anti-inflammatory properties that can help reduce the risk of heart disease by lowering cholesterol levels and reducing oxidative stress. Here is a simple recipe to incorporate ginger into your diet. Ginger tea recipe. Ingredients: 1 inch of fresh ginger root, 1 lemon, 1 tablespoon honey, 2 cups water. Instructions: peel and grate the fresh ginger root. Boil 2 cups of water in a saucepan. Add the grated ginger to the boiling water and let it simmer for 5 minutes. Squeeze the juice of 1 lemon into the ginger tea. Stir in 1 tablespoon of honey. Strain the tea and serve hot. Enjoy this tea 2 to 3 times a day for best results. In conclusion, heart disease is a serious condition that affects millions of people worldwide. By understanding the warning signs and taking steps to reduce risk factors, it is possible to prevent or manage heart disease. Lifestyle changes such as eating a healthy diet, exercising regularly, and quitting smoking can go a long way in reducing the risk of heart disease. If you are experiencing symptoms or have risk factors, it is important to seek medical attention promptly. Remember that early detection and treatment can greatly improve the outcome and quality of life. By incorporating ginger tea into your diet, you can also support heart health in a natural and delicious way. Always consult with your healthcare provider before making any changes to your diet or starting any new treatment.